Hi, my name is Chris Braley, and I will be talking about HSV meningitis. This disease is devastating, especially in infants, due to their age and their lack of day-to-day rituals and stuff. They are not easy to detect when this occurs in them. This causes it to be a major issue and sometimes results in the death of an infant. So what exactly is meningitis? According to EHOW, meningitis is a serious inflammation that infects membranes which cover the brain and spinal cord. When this membrane, also known as the meninges, become inflamed due to the bacteria or viral infection, it can be a life-threatening situation, especially in infants. HSV stands for the herpes simplex virus. Yes, it is the one that is commonly transmitted through sexual intercourse. To get a better understanding of meningitis, we must first know what the causes are. According to EHOW, as many as 95% of the viral infections caused by HSV result from intrapartum transmission with occasional postnatal exposure by oropharyngeal shedding or cutaneous shedding of virus by parents or hospital contacts. Late presentation in the second postnatal week is more commonly seen than early presentation and disseminated disease. Most cases obviously occur through contact with somebody with HSV, whether it be the mother or a hospital worker who didn't realize they had a cut or something on their hand or right above their glove and touched the baby when it was delivered. Due to their undeveloped immune systems, HSV can cause great losses amongst infants and newborns. The most serious of these losses is death, which obviously death is a major loss. But some of the less serious but still major setbacks can be blindness, or other mental issues, likely setting them back and having them have to go through special needs programs throughout their life. Now that we know what causes meningitis, or HSV meningitis, we also need to know what types of signs to look for, because knowing the signs will go a long way in determining whether your child has HSV meningitis or not. How do we know? Some of the symptoms can be similar to bacterial meningitis, which include paleness, irritability, high-pitched crying, and respiratory distress. Some of the other symptoms are weakened and sucking methods for feeding and pacifying themselves, a low temperature, and a bulging soft spot in the head, which would just normally be still. They also can become lethargic, and that is where one of the harder signs come, because most babies aren't very active when they're newborns or infants, because most of the time they sleep all day or eat, and if they're not doing one or the other, it's hard to tell. So knowing whether your baby is tired or sick can go a long way. But knowing these symptoms is just not enough. To have a better understanding of these symptoms, you must know how to treat them, and because the difference between that can be life and death. For treatment, first go to see a physician to determine if your child does have HSV meningitis or if it's just some minor illness. The treatment strategy, according to eMedicine, is aggressive antimicrobial intervention and life-saving in neonates with suspected meningitis. Because distinguishing between viral and bacterial meningitis is difficult early in the clinical process, a combination of agents is often necessary, providing coverage for both types of infections. Treatments, there are many treatments, but the most common and preferred method is acyclovir in infants. This is administered through IV, and it is a 21-day course through the antibiotic. If not treated, HSV meningitis is very deadly in infants and newborns. The more you know with this and the more you react to the signs and symptoms, the better your child's chance at having a full life and healthy life. So the quicker you get treated, the quicker you can save the child's life, and what you learn will save their lives. Thank you for your time.